Welcome to Pediatric Conditions 101. My name is Dr. Larry M. Finkelstein, and I am a pediatric nurse practitioner at General Hospital in Swayze, Indiana. Today's topic is acute glomerulonephritis in children. This disease is most commonly found in children more than 2 years of age and more common in males and females. This is a condition in which certain immune processes injure the glomeruli in the kidneys. The immune system causes inflammation, which results in altered glomerular structure and function in both kidneys. This usually occurs after infection, usually an upper respiratory infection or certain skin infections. The most common form is acute post-streptococcal glomerulonephritis. This is caused by an antibody-antigen reaction secondary to an infection with a nephrogenic strain of group A beta hemolytic streptococcus. The most serious complications of this disease is progression to uremia and complete kidney failure. There is no specific medical treatment. The treatment for this disease is aimed at maintaining fluid volume and managing hypertension. And for those of you who do not know what hypertension is, it is simply high blood pressure. If there is evidence of a strep infection, antibiotic therapy is necessary. For nurses out there, some nursing management of this disease would be to administer antihypertensives such as labetalol or nifedipine and certain diuretics as ordered by the doctor. What is labetalol and nifedipine, you may ask? Let's go to our handy Davis Drug Guide for Nurses and look them up. First off, labetalol is an antihypertensive in the category of a beta blocker. The indications for this medication is management of hypertension. The action is it blocks the stimulation of beta 1 and beta 2 adrenergic receptor sites. The therapeutic effects of this medication is decreased blood pressure. Some contraindications of this medication is uncompensated congestive heart failure, pulmonary edema, and bradycardia. Some side effects of this medication are fatigue, weakness, arrhythmias, and bradycardia. Now, what is nifedipine? Well, let's look it up while we're in here too. Nifedipine is also an antihypertensive, but in the category of a calcium channel blocker. Some indications of this medication are management of hypertension. The action of this medication is it inhibits calcium transport into myocardial and vascular smooth muscle cells, resulting in the inhibition of excitation, contraction, coupling, and subsequent contractions. The therapeutic effects of this medication is systemic vasodilation resulting in decreased blood pressure. Some contraindications are hypersensitivity and sick sinus syndrome. Some side effects of this medication are headache, arrhythmias, congestive heart failure, and pulmonary edema. Okay, now back to our show. A nurse also wants to maintain sodium fluid restrictions as prescribed by the doctor during the initial edematous stage. Also, you want to weigh the child daily on the same scale to maintain accuracy. Also, you want to keep the child on a strict intake and output to monitor urine color and urine amount. Also, you want to provide a neurological evaluation as hypertension may cause encephalopathy and seizures. For some teaching topics, parents, if your children has a strep infection, make sure they take the exact course of the prescribed antibiotics to make sure that the infection is eradicated. If the infection is not eradicated after the course of the antibiotics, take the child to the doctor immediately to make sure that they do not get the glomerulonephritis. Also, if glomerulonephritis is mild and the edema is mild, parents may weigh their children at home. Also, monitor their intake and output and monitor their blood pressure. The book used for the information found today is The Essentials of Pediatric Nursing by Terry Kyle, published by Lippincott, Williams & Wilkins. Thank you for your time today. That is all I have.